Hello dear patients, today we are going to review the case of deposits on foreskin. A young man came to us and his glans penis was almost clean, but deposits always appeared on foreskin. There was some itch in urethra. His wife complained on the fact that after a sexual contact with him, itch appeared in her vagina. On observation we noted white deposit without significant reddening of foreskin. He was checked for sexually transmitted infections from deposit and from inside the canal. It was all negative, including 8 fungi of candida. Culture test for candida was also checked. It was all negative. Analyses were taken from inside the canal, bacterial culture test and bacterial culture test from deposit itself. The same bacteria were found in different concentrations. These were marganella or klebsiella. They may be called differently, but this is a potentially pathogenic flora, disorder of bacteria. The disorder of bacterial concentration was more on foreskin. So, in such cases you shouldn't rely on some magic ointment with antibiotics, as they do in many dispensaries and other places. These bacteria live in urethra. What would an ointment with antibiotics do? It would only make it used to these antibiotics, make these microorganisms resistant, but in any case they would remain in urethra. So, prescribing an ointment only, as many doctors in dermatovenerologic dispensaries like, unfortunately is useless here. A complex treatment of inflammation in the canal is necessary. There were not a lot of leukocytes there, about 5-7, but it was still there. The deposit on foreskin has to be treated as well, together with the wife. In this case, antibiotics were prescribed according to sensitivity of these microorganisms in the form of tablets. Longidasa enzyme was prescribed, ozone and polyoxidonium were prescribed, and instillations into urethra were prescribed. So a course of treatment took 10 days. Sometimes it takes longer, as bacteria are potentially pathogenic. Often they are not much sensitive to antibiotics, as they are always there, not on our skin, but on other areas. However, this deposit completely resolved. Later on, the patient was recommended to do baths with furosemide every day for prevention. He was also recommended to follow hygiene. Treatment of wife took much longer, as the first course of treatment didn't bring any success. These bacteria enrooted in vagina. So a complex treatment was prescribed, together with suppositories, baths with injections, etc., done by gynecologist. Only after the second course of treatment, these bacteria were changed by normal flora of vagina. For that, a course of restorative therapy was needed to restore the flora of vagina. You can watch a separate video about what it is on our channel. So it's not always the case that seemingly simple symptom, as deposit on glans penis, can be washed out by water with soap or to use some magic ointment. This doesn't always bring the effect. This couldn't bring any effect as it's present in vagina, even if it's absent in urethra. This is impossible. So, always, even if sexually transmitted infections are absent, both sexual partners should have a competent examination. Unfortunately, it's not always possible to have it in free medical facilities. Culture tests should be done correctly after special preparation, sometimes even using provocation method. Only after that a competent treatment should be prescribed. Only in that case it would be quite successful, otherwise relapses are common and a resistance of bacteria, the more so potentially pathogenic ones, would appear to different antibiotics. If it is necessary to diagnose and treat deposits in the area of penis, glans penis and other problems related to male and female sexual organs, You can consult venerologists, urologists and gynecologists of our paid medical center of Dermatovenerologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such problems. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.